This is my certificate for Theranos showing my shares, and it was actually signed by Elizabeth Holmes. A sad bit of history, but history nevertheless. Elizabeth was in stealth mode so that we had no idea whether it was going well or was on the brink of collapse.
The story of Elizabeth Holmes and Theranos is one of the most infamous financial frauds in modern history, involving a charismatic Silicon Valley entrepreneur, a groundbreaking idea, and a string of lies that ultimately defrauded investors, patients, and the healthcare industry. The case is a striking reminder of how ambition, deception, and an unrelenting drive for success can result in criminal wrongdoing on a massive scale. Elizabeth Holmes, a Stanford University dropout, founded Theranos in 2003 at the age of 19. Her vision was ambitious and revolutionary: to create a device that could perform a wide array of medical tests with just a few drops of blood, vastly reducing the cost and time required for traditional testing. Holmes believed that this technology could democratize healthcare, offering faster, cheaper, and more accessible diagnostic solutions. Holmes was a charismatic leader who often appeared on magazine covers, earning the comparison to Steve Jobs with her signature black turtlenecks and determined persona. She was able to attract attention and investments for her company, despite the lack of a fully functioning product. In fact, at the time of her rise, Theranos was valued at over $9 billion, making Holmes one of the youngest female billionaires in history. The core of Theranos' promise was its proprietary technology, the Edison device, which was supposed to analyze blood samples from patients and deliver results for a wide range of tests. However, the reality behind this technology was far from revolutionary. In the early stages, the Edison device was plagued with technical flaws. It couldn't deliver accurate or reliable results, and the data produced was often erroneous. Instead of abandoning the faulty technology, Holmes and her team chose to hide the truth. They falsified results and misrepresented the capabilities of the Edison device to investors, doctors, and the public. A key element of the fraud involved how Holmes and her team manipulated both internal and external data to create the illusion of success. They doctored test results and used commercially available machines for some of the tests, rather than relying on their own Edison devices. In some cases, Theranos employees were instructed to secretly run tests on traditional equipment, while publicly claiming the results were generated by their proprietary devices. Theranos attracted a high-profile group of investors and advisors, many of whom were respected figures in finance, business, and politics. Some of the notable names included former Secretary of Defense James Mattis, former UDOTIS, Secretary of State Henry Kissinger, and prominent venture capitalists like Tim Draper. Holmes leveraged these relationships to project an image of legitimacy and credibility, which played a critical role in securing tens of millions of dollars in funding. Many of these investors were blinded by the allure of what Theranos promised. The idea of transforming healthcare with a single device was incredibly enticing, and Holmes was a master at selling the dream. She often downplayed the risks and challenges of the technology, using her charm to mask the growing concerns raised by engineers and experts within the company. As the company continued to grow, the hype surrounding it intensified. At one point, Theranos was valued at $9 billion, and Holmes became the youngest self-made female billionaire in history. She graced the covers of magazines, and her company was regarded as one of the most promising startups in Silicon Valley. However, while the company was basking in public admiration and investor confidence, the reality behind the scenes was far from rosy. Whistleblowers, including former employees, began to come forward with information that cast doubt on the company's operations. As early as 2015, former employees and insiders began to raise alarms about Theranos' deceptive practices. One of the most prominent whistleblowers was Tyler Shultz, a former Theranos employee and the grandson of former Secretary of State George Shultz, who served on the company's board of directors. Tyler Shultz, along with other insiders, began to uncover the extent of the fraud. discovering that the Edison device was not capable of delivering accurate results. Schultz and his colleagues grew increasingly concerned about the potential harm the faulty devices could cause to patients, as inaccurate test results could lead to misdiagnosis and improper treatments. Despite these concerns, Holmes and the company continued to dismiss the warnings and push the narrative that the technology was near perfection. In 2015, investigative journalist John Carreyrou of the Wall Street Journal began probing the company. Carreyrou's investigation uncovered a series of disturbing facts about the company's operations, including falsified test results, secret use of commercial machines, and efforts to silence whistleblowers. After months of investigation, Carreyrou published a groundbreaking story that exposed the extent of the deception, leading to a major public scandal. The revelations prompted further investigations by the U.S. Securities and Exchange Commission, SEC, the Department of Justice, DOJ, and the Centers for Medicare and Medicaid Services, CMS. As the truth came to light, it became clear that Holmes and her company had systematically defrauded investors, doctors, and patients by misrepresenting the capabilities of their technology. In 2018, the SEC charged Elizabeth Holmes and former Theranos president Ramesh Sunny Balvani with a massive fraud scheme. The SEC accused them of engaging in an elaborate, years-long fraud in which they exaggerated or made false statements about the company's technology, business, and financial prospects. Holmes and Balvani were accused of misleading investors by claiming that Theranos technology was capable of revolutionizing healthcare, when in fact it was unreliable and not ready for commercial use. The SEC alleged that Holmes and Balvani misled investors about the accuracy and reliability of the Edison device, as well as its approval status from regulators like the Food and Drug Administration, FDA. The SEC also accused them of inflating the company's financial performance and hiding the true status of the technology from investors and the public. Holmes agreed to a settlement with the SEC, which included a $500,000 fine, the return of 8.9 million shares of Theranos stock, and a ban from serving as an officer or director of any public company for 10 years. However, Holmes did not admit or deny the charges in the settlement. Balvani, who faced similar charges, denied the accusations and faced a separate criminal trial. In 2021, Holmes went to trial on criminal fraud charges, accused of defrauding investors and patients. Prosecutors argued that she knowingly misled investors and patients, making false claims about the technology's capabilities and putting lives at risk in the process. Holmes' defense team argued that she was misled by her former partner, Sunny Balvani, and that she had not intentionally deceived anyone. After months of testimony and legal proceedings, the jury found Holmes guilty of 3 counts of wire fraud and conspiracy to commit wire fraud in 2022. She was sentenced to 11 years in prison for her role in the scheme. The trial exposed the depths of the deception and the manipulation of investors in the healthcare system for personal gain. The rise and fall of Elizabeth Holmes and Theranos is a cautionary tale about the dangers of unchecked ambition, the cult of personality, and the willingness of investors to believe in the next big thing without conducting due diligence. Holmes' case serves as a reminder of the ethical and legal responsibilities that business leaders have to their stakeholders, particularly when it comes to public health and safety. Theranos' fraudulent activities not only cost investors billions of dollars, but also jeopardized the health and well-being of countless individuals who relied on the company's faulty blood testing technology.